Barrett. Question 1. A 3-year-old with central epigastric pain. Blood test for raised amylase. These likely diagnosis is Nashcan and purpura. Raised serum amylase means pancreatitis. So pancreatitis can be caused by choledochrono cyst, cystic fibrosis, non-external injury, may also cause pancreatitis and rubella. But Nashcan and purpura does not show increased amylase, but it must show bloody diarrhea also and rashes. 2002, 15-year-old boy, serum creatinine and urinary VMAs are raised. CT of the left abdominal shows pericardioma and multiple cysts within liver, pancreas, and both kidneys. What adrenal period would you look for? CNS meningioblastoma, because diagnosis is 1 Hippel-Lindau syndrome. How do you know? Because there's left adrenal pericardioma and multiple cysts within liver, pancreas, and both kidneys. Cysts within liver, pancreas, and both kidneys means VHL. So what else do you look for? CNS meningioblastoma. 2003 ultrasound at 4 days, baby shows unilateral right side neonatal heart nephrosis. What are the commonest cause of findings? Pelvic ureteric junction obstruction. In newborn baby, and unilateral heart nephrosis, most common causes pelvic ureteric junction obstruction. Unilateral heart nephrosis in children, most common causes pelvic ureteric junction obstruction. 4, a 1-year-old boy presents with acute history of cough, wheeze, and respiratory distress, which is true. An inhaled foreign body is equally likely to pass into either main stem bronchus, right or left. When young child with sudden onset of cough, wheeze, and respiratory distress, which is true, inhaled foreign body is equally to pass into right or left main stem bronchus. No other option makes sense. Collapse of lung or lobe is the commonest radiological presentation. Acutely is wrong. The majority of foreign bodies are radiopaque and can be seen on X-rays. Is also wrong. Major shift on expiratory radiograph fluoroscopy towards the left side wrong. Normal imaging of extrude the vaginal inhaled foreign body wrong. Because number 5, which will actually increase patient dose, reducing the gantry rotation. Because at the CT scan machine's rotation is slow, so the patient will be exposed to more radiation and it will increase patient dose. Other are all wrong options. Question number 6, which findings favor Willem's tumor or neuroblastoma? Mass invades into intravenous cava. Neuroblastoma encases vessels and Willem's tumor invades vessels. Willem's tumor, mass invades intravenous cava. Question number 7, subdural hematoma. Which findings are less specific for non-external injury? Subdural hematoma underlying of skull fracture. Because when there's skull fracture, then means it must have subdural hematoma with it. It may be accidentally. But rest all other may show associated presence of retinal hemorrhage, bilateral SDH, infused hemispheric SDH, so SDH of different age is also non-accidental injury. Question number 8. A 3-year-old boy with abdominal swelling, CT shows large 12 cm mass inferior to liver, distortion of the real parenchyma, apparent hepatic growth, aorta and intravenous cava space, which is not a known association, cerebral ataxia. These all findings show Willem's tumor. Willem's tumor is associated with Beck-Win-Wiedemann syndrome. All these are features of Beck-Win-Wiedemann syndrome, except P. Cerebral ataxia not seen in Beck-Win-Wiedemann syndrome. Question number 9. Neonatal male patient who failed to pass meconium by 48 hours and was found to have an infrared anus of the high manipulation subtype. Oculostomia was performed in the neonatal period and surgical repair completed in infancy. At the age of 5, the patient presented with UTI. What is the likely underlying etiology of the UTI? Neurogenic bladder. When a child has failure to pass meconium and then infrared anus, so this abnormality is called bacterial VACTERL anomalies, and in that there is also neurogenic bladder can be caused. And then the patient colostomy is performed and surgical repair completed of rectal and rectum malformation. So this can result in neurogenic bladder. So in 10, ultrasound scan of the hips which constitute an abnormal result, 60 degrees for beta angle, because beta angle should be less than 55. 11, pulmonary sling is suspected, which finding is most likely seen, posterior trachea and anterior esophageal compression, because pulmonary sling is between trachea and esophagus. Question number 12, an 8-month-old boy with prolonged cough on reduced air entry on right side, suspected of mediastinal chest on toward the left side of the chest, with most likely to diagnose congenital lobar emphysema, because suspected mediastinal shift toward the left side of the chest. Contralateral reduced air entry on the right side, and then contralateral shift mediastinum. Most common cause is congenital lobar emphysema. Just all do not make sense. Question 13, mechanism verticunum. Most sensitive radiological investigation is 1699 Emperor Technical Geography. Question 14. An 18-month-old boy neuroblastoma series of metastases in the skin, liver, lung, and bone marrow. Appropriate staging is stage 4 because stage 4 correct. Another stage is option E is stage 4S. Stage 4S occurs in less than 1 year and has good prognosis. But this patient is 18 months old, more than 1 year. And then series of metastasis in the skin, liver, lung, and bone. So metastatic distant metastasis stage 4, and it is poor prognosis. Option E is wrong because it occurs in less than 1 year and has good prognosis. Question 15. MR shows midline vermian mass which abuts the roof of the fourth ventricle, displaying the brainstem anteriorly. Hyperintense on T2 and enhances homogeneous on T1 following internal contrast, most likely diagnosed medulloblastoma. Roof of fourth ventricle, vermian mass, medulloblastoma. 16. Which types of craniocystosis is it correctly linked to the suture involved? Scapulocephalic cyclic suture. S for scapulocephalic, X for cyclic suture. 17. Interception risk on narrated to fluoroscopic reduction. Hypovolemic shock. Because hypovolemic shock shows bowel ischemia, and bowel ischemia is contraindicated to fluoroscopy reduction. 18. XR on 4th day old neonate born at 32 weeks who is not to be having increasing abdominal distension, appearance is unwell, indicating of unknown surgery as pneumoperitoneum. Because this is born at 32 weeks premature baby, and then he may pneumoperitoneum shows necrotizing enterocolitis in the premature baby, so it is indicated for surgery. 19. A 14-year-old girl with abnormal curvature of the spine, no back pain, obvious scoliosis, most likely cause is hemivertebral. Because she has painless scoliosis in a child is most likely cause is hemivertebral. The rest all options show painful scoliosis. Painless scoliosis in a child is hemivertebral.